I got the thumbs up. All right. Hello, everybody. Welcome. This is the Moving Forward Coalition conversation for today. And we're really thrilled to have a fantastic panel of speakers and all of you, because these are calls, as you know, if you've been on them before, where we encourage everybody to contribute and participate. And we learn as much from you as you do from us many times. Today's topic is called, our title for today was How Nursing Homes Can Get Involved in the Age-Friendly Movement. And that's going to include not only nursing homes, but it's going to include speakers who are going to talk about public health. They're going to talk about ecosystems. They're going to talk about nursing homes as part of communities, and all of this related to age-friendly health systems. So again, I'm going to introduce our speakers for today, and then I'm going to turn it over to Jane Carmody, who's here from our funder, the John A. Hartford Foundation, and see if she'd like to say a few words of welcome as well. But in a moment, you're going to hear from three wonderful panelists and colleagues. One is Amanda Meyer, who is a project manager for age-friendly health systems at IHI. I have the honor and privilege of working with Amanda a great deal of the time. And then two folks who are going to tag team, because they do a lot of work together on age-friendly ecosystems and public health. Jody Hsu, who's a past executive director of the Age-Friendly Institute and previously director of Age-Friendly Rhode Island, and Megan Wolf, who's senior policy development manager at TIFA, which is Trust for America's Health. So you can see their full bios in the announcement that went out to all of you. And before I turn it over to Amanda, I just want to see Jane Carmody. I think you're on the call, and wanted to see if you wanted to take a minute and just add any words of welcome to all the folks who've joined us today.
There we go. Isaac has that power to mute people. I'm telling you, that's great. Anyway, thank you so much. This is so exciting. I can't wait to have this coalition conversation. Huge fan of Alice and the Moving Forward Coalition and the great work that they're doing. Huge fan of Trust for America's Health and the work that they're doing, and Megan and Jody, and huge fan of Amanda. I've just heard Amanda speak last week on developing a nursing home cohort for age-friendly. So Alice, I can't wait. Alice, we adore you and appreciate everything you're doing to move quality forward with nursing homes. So glad to be here.
Well, thank you. And I'm going to first say that, Isaac Longobardi, who's our director, who's very quietly in the background, as you know, orchestrates all of these calls and plans them and does all of that. So it's a team effort. Anyway, I just also will say very briefly that this is a wonderful group. We have many people. We have almost 100 people on this call today. We have nursing home residents, people who are living in nursing homes. We have advocates and advocacy organizations. We have clinicians. We have researchers. We have policymakers. We have family members and care partners. We have geriatricians. And many others. And again, we have people who've worked in the QIO network, friends, colleagues, and others. So, and we have people from one of the GWEPs just chimed in. So we're glad all of you are here. With that, I'm going to turn it over to Amanda Meyer, and she's going to share some slides and her perspective on things. And Amanda, take it away.
Thanks, Alice. And Isaac and Jane and all. It's really lovely to be here with such a great, huge, and diverse group of people that want to talk about age-friendly health systems and nursing homes and how that relates in the setting itself and also in the larger community and the ecosystem. Alice, you can see my slides, right? Good. Okay. I'm Amanda. I am a project manager at the Institute for Healthcare Improvement, which we refer to as IHI. And we within the age-friendly department, I'll call it at IHI, work with health systems, several different settings, hospitals, ambulatory. We just started with home health, nursing homes, convenient care clinics, to help them bridge and bring these age-friendly 4Ms, which I will introduce to you today, to the greatest number of older adults possible, so that all older adults can receive the best care, no matter which setting door they go into. So I'm joining you from sunny Colorado. It's pretty nice here today, and I will provide a base of what age-friendly health systems entails, what the 4Ms are, a little bit of history and how we got there, and then focus really, really clearly on nursing homes and what it means to be in age-friendly nursing homes, how you can get involved in the movement, whether you are working in a nursing home, living in a nursing home, or just have a connection to one down the street. So I'll start with the mission of the age-friendly health system movement in general. And as you can see there, and how I mentioned earlier, that it's that all care provided to older adults is age-friendly care. And what we mean by that is that it's guided by the 4Ms, which we call an essential set of evidence-based practices. It's really what we believe are the core issues for the healthcare for older adults. Importantly, it causes no harm to the older adult, and is consistent with what matters, which is one of the 4Ms, to the older adult, their family, and their care partners. I've worked with enough older adults in my nursing home life to know that not everybody has family caregivers, but whoever might be connected with that older adult as a person that cares for them. The way that the age-friendly health systems movement came about and the way that it's developed is that, as most of you probably know, there's a lot of different methodologies and frameworks that you could provide care to any older adult with. And some of the experts at IHI and beyond came together about 2017 to review all of these 17 on this screen, different care models, and found that if you put them all together and you looked across them, you could probably distill it down to what we called the vital few, the 4Ms, that were applicable no matter where an older adult was getting their care, whether it was with their primary care physician or a specialty practice, whether they were an inpatient at a hospital or in a subacute rehab facility. These 4Ms matter to everyone. And so these vital few became what the age-friendly health systems movement has been built on, and we call them the 4Ms. I've given you a little bit of the whys. You can also see what the 4Ms are here on this screen. We begin usually most conversations with the what matters M. It acts as sort of the umbrella that all of the other M's live underneath and affect each other. It really is a living framework where if you make adjustments to one thing for an older adult, let's say their medication, very likely is going to have an impact on their mentation, the way that they mobilize and get around the world. And all of those interact together on what matters to them as well. And so we believe that using this framework and using this approach with older adults actually simplifies and reduces what it takes and the burden on staff in various settings to streamline the care for older adults and improve it as well. The way that age-friendly health systems at IHI works is that we try to help all various settings learn about the 4Ms, learn about quality improvement, put those things together toward improving healthcare for older adults. And we encourage this and recognize this through our recognition system. There are two different levels of recognition through IHI. The one is level 1 participant, which you can see we've recognized almost 5,000 settings. And that's across the world, in the US and across several countries around the world. And that level 2 is this committed to care excellence, which we're approaching 2,500 settings. Level 1 is really a plan. Nursing home or any kind of setting submits a plan for how they are currently providing the 4Ms, because most nursing homes are already doing a lot of this work. And then finding where those small gaps are, those larger gaps, what they can do in their quality improvement journey to close those and improve the care for older adults. That recognition comes with your plan for what you're going to do. And then the level 2 recognition comes with just a little bit of data. I'm not going to get crazy into that, but it's very easily approachable. It's a flat count of how many older adults get all 4 of those M's in a given month. And you can see here where we are broken down for nursing homes specifically. We're approaching 800 facilities across the world. We've got some in Australia and Ireland. and at level 1, and then we've got about 400 that have started turning in some data to show that they're really putting that plan for level 1 recognition, that plan into action with their residents. And that's a lot of people, 4.6 million. We think this is a conservative estimate. We gather this from those counts that sites submit, and 4.6 million is definitely the ground level of how many adults across the world have gotten 4Ms care. So any setting that's going to embark on age-friendly health systems and the recognition process looks at starting with the 4Ms journey using 2 different steps. The first one is assessing each of the 4Ms, learning about it from the perspective of the older adult, and then acting on it. Most nursing homes, you will find, just as part of the MDS process, are doing the assessment part for almost all of the Ms. Usually the activities director or the social worker is probably gathering what matters to the resident on admission, and you've got a pharmacist and doing the medication reviews. And what most nursing homes find that the next step for them is actually, how are we acting on it? How is it getting into the care plan, and how are staff across all levels, including CNAs that work with the nursing home residents one-on-one, all the way through to family members that are involved in someone's care, are hearing and understanding and able to act on all 4Ms for a resident. And to do this, IHI has created, with the help of several nursing homes actually, back in 2020 during the prototyping for the 4Ms in this setting, we provide a couple of tools, and one of them is a workbook. The workbook will go over everything that I'm saying right now, plus lots and lots of other information. Resources with links to different tools, different assessment tools, different ways you can act on the 4Ms. That will all be within this workbook. And it's totally as a reference and a resource to the nursing homes that are working in the movement. And then uniquely for nursing homes, the only setting in age-friendly health systems that has their own workbook. And this is just in recognition that nursing homes have different varying levels of technology ability, differing workflows than a lot of hospital systems tend to have. And so if you're paper charting or your CNAs can't get on your EMR and they need flow sheets or worksheets that they can use on the units, the nursing home really simplifies that workbook and brings in some of those easy to use real life tools that you can use within your facility. There's 3 main ways nursing homes can engage with age-friendly health systems and become recognized by IHI and the John A. Hartford Foundation. And one of those is our action communities. We have one beginning in March that IHI runs. Those are 7 months long. They're monthly 1-hour webinars with experts, with a quality improvement advisor, with nursing home specific experts. Alice comes along with us on the journey of the action community, and that's great for systems that are brand new or sites that are brand new to the movement. We will start at the bottom and we'll take you through every single step. We also do some peer coaching and peer support just with nursing homes, and Alice helps us lead that as well. This is free to any system that wants to join, and don't let the whole thought of the 7 months scare you. You can take and leave what works for you. We do some scale-up partnerships, and we have done this with some nursing homes, larger systems like CVS and the VA. Right now, Common Spirit is involved in kind of more of a scale up where they're recognizing like all of their nursing homes within a couple of months. That might be hundreds of sites. It might be 10 sites. And we can do that if the way that the 4Ms are practiced site to site is similar or the same. And then the DIY, do it yourself. The pathway that I think most nursing homes, actually I know most nursing homes take, is they go on our website and they start looking at these resources. You can actually schedule a one-on-one with myself or Alice as many times as you need to as you're going through the process. And they just handle getting the care description and the recognition and starting that journey within their own facilities with that kind of support. All of those are good. There is no bad way that you can become involved. I mentioned the action community. I'll make sure after my presentation, I put all these links in the chat, which will include the opportunity to learn more about the action community. Reach out if you have questions and get registered if that's something that you're interested in. I pretty much covered the whys. Obviously, we're all in this to improve the care of older adults that we love. And that's what the 4Ms framework can help make more consistent and widely utilized across nursing homes and all of the other settings that older adults use for their health care. Of course, the recognition, which I covered, that's from both IHI and the John A. Hartford Foundation. When you're recognized, you get a congratulations email with all sorts of press releases and logos, things that you can use to make posters and share with your community, your referral partners about how great the work you're doing is and how you're helping improve what happens for the older adults within your care. And also importantly, which I'll highlight next, are some key indicators that are coming out about patient satisfaction, improved outcomes, reduced falls, reduced hospitalizations, ER utilization, things like that are really important to nursing homes. These are a couple of quotes from nursing homes that have been involved recently in the age-friendly health systems movement, one from Hebrew Senior Life on the East Coast, I believe they're in Massachusetts, and then Dr. Marcus Rope, who works with the VA. The VA is one of our scale-up partners that's recognizing all of their nursing homes. These slides will come out to you and you can read these quotes, but you can see kind of the overwhelming positiveness that these people have seen by utilizing this approach within their nursing homes. There's a specific list of case studies that will come with this slide as well. This is pulled out of there, and it just each case study shows how a nursing home has done this work in their own unique way. And you can see here that this particular Good Samaritan facility saw a reduced rate of antipsychotic medication usage during their journey. And this article from Dr. Rope and Dr. Schwartz, who's one of our faculty experts at IHI that works with nursing homes and ambulatory care settings, started looking at the outcomes in one of their VA facilities that adopted the 4Ms. And you can see some pretty amazing outcomes that we hope to see replicated in papers coming up in the next couple of years. These are the case study links that I'll send out. I'll put all of this in the chat at the end of my presentation, and you'll be able to click on these through the slides. And I will wrap it up from there and look forward to hearing from my other colleagues about the age-friendly ecosystem and age-friendly public health.
Wow. Well, that was a fantastic overview, Amanda, as always. And I always learn something, even though I've heard you present many times. I think what we'll do is if anybody has any pressing questions, please put them in the chat. But I think maybe what will be most helpful, since we have such a large group, is to have Megan and Jody go ahead and do their presentation, and then we'll still have plenty of time left for questions afterwards. I will say, in introducing Megan and Jody, which I already did, just to add to it, if you guys could talk at some point during your presentation or at the end of it about how people in the community can bring these ideas about age-friendly health systems to the nursing home. If maybe the nursing home hasn't heard about age-friendly, doesn't know very much about it, maybe anything you want to say. And then again, we've got lots of people on this call who can contribute their thoughts as well, but just wanted to put that out there to link things together. So with that, I think Isaac's going to pull up your slides and we'll go from there.
Sounds great. Thank you so much, Alice.
One question in the chat first that may be worth addressing, related to where workbooks can be found.
Oh, to obtain workbooks, that Amanda referred to. Amanda,
I'm about to go and put them all in the chat right now.
Okay.
Yep.
They're on the IHI website, and Amanda will put the links in right now. So thanks, Isaac. All right. I think Megan and Jody, we're over to you.
Awesome. Thanks so much. Oh, thanks, Isaac. Got the slides up already. Awesome. So thank you for having us. Jody and I are just delighted to be here with you to introduce you all to the age-friendly ecosystem and its fantastic potential for nursing home engagement. As Alice said, I represent Trust for America's Health, or TIFA, which is a nonpartisan, nonprofit public health advocacy and research organization based in Washington, D.C. We lead the age-friendly public health systems movement, and I'm going to tell you a little bit more about that in just a few minutes. So our plan today is to spend the next 10 or 12 minutes giving you an overview of the ecosystem and helping to prompt your thinking about how nursing homes can engage as really a vital member, of a pillar almost of the community within this age-friendly work. The Moving Forward Coalition focuses on this nursing home transformation. That's such an audacious goal, but we think doable. We believe that nursing home participation in the age-friendly kind of movement in all the different sectors, and engagement with the sectors can play a huge role in achieving and realizing that transformation. So lots of opportunity, we think, for you all for engagement, and we're excited to be here to share what we know and hopefully inspire you to learn more. So over to Jody.
Great, thank you. Next slide, Isaac, please. So you're looking at chaos. So this is the idea that we wanted to present visually to you of how we see oftentimes the various elements of efforts to improve the health and quality of life outcomes for older populations. We know today that there's incredible work happening across what we refer to as the age-friendly ecosystem, and I will explain that in a moment. We know that it's happening. We know the work is happening, but we also know that at present, systems of engagement and support and care for the older adult population tend to, not always, but they tend to exist in this tapestry, sort of haphazard tapestry of healthcare, including in nursing home settings, public health, as Megan referenced, and we'll tell you a little bit more, aging services, et cetera. And research and data collection also remains somewhat inconsistent when it comes to older adult health and well-being. There are definitely exceptions to this rule, but we hear over and over that the cross-sectoral work that could allow for efficiencies, the lack of duplication, and better use of resources can really be a challenge. We also know that meaningful change in policy and systems that would lead to effective support and care for older adult health and well-being do require collaboration and coordination across the various sectors. And now more than ever, does seem that leaders are presented with a challenge, a unique challenge to align and coordinate their work so that it can deliver improved results. So what could this look like? What would that coordination look like? It could involve eliminating silos in our work, prioritizing shared goals, elevating older adult voices across sectors, sharing expertise, et cetera. So what I'd like to do in the next slide is introduce you to this idea, thanks Isaac for moving along, to the very idea of what we refer to as an age-friendly ecosystem. So the age-friendly ecosystem, as you can see here, is defined as a multi-sectoral network of practitioners, providers, and organizations that prioritize improved quality of life for older adults, their families, caregivers, and communities through collaborative impact. The visual that you see on the right-hand side of the screen allows you to get a sense for the sectors that are currently engaged. And those include, obviously, healthcare systems, as Amanda helped us understand, public health departments, the aging services sector, academia, businesses, and communities where age-friendly practices are being implemented. And so what we're talking about when we refer to the age-friendly ecosystem is being very specifically intentional in our ability to look across these sectors of our work and to consider how, not just if, but how we can engage with each other across sectors to improve quality of life and outcomes for older adults, wherever you live. So the opportunity at hand is to consider how practitioners and sector partners, and today specifically nursing homes, can reach across the age-friendly ecosystem and the other initiatives that are at play and work collaboratively to coordinate policy in the big macro sense, systems, but also programs and services that benefit older adults as they navigate all of these aspects of their lives at home, in their workplaces, in healthcare settings, and in the communities where they live. So our plan for the next just few minutes is to walk you through very briefly those sectors, and then to share some specific examples of what it might look like for nursing homes to engage with the sectors. And in doing this, we hope that we can jumpstart your enhanced understanding of what's going on in these sectors, because that would sort of allow you to have a bedrock of understanding like how we might collaborate. And become more cognizant of each other's work, which would, increase the likelihood that we could develop meaningful partnerships. So I'm going to hand it off to Megan, who's going to walk us through the first couple of these sectors. And Megan, off to you.
Great. Thanks so much, Jody. So Amanda covered age-friendly health systems so well and so thoroughly. I'm not going to spend a lot of time here, but just to say that we think that nursing homes already have a head start in this broader ecosystem work because in some senses, nursing homes are already age friendly, right? I mean, this is the population, this is the core of the work that nursing homes do. And the Forums framework definitely gives you that place to start, those first steps, and especially thinking about what matters to residents as well as the staff. What matters is something that I think can kind of carry over to all the different sectors and the different frameworks that we work in. But this is definitely a really good place to start. Next slide, please. So the next sector we want to introduce is public health, which should be a valuable engagement partner for nursing homes. So what you see on this slide is TIFA's framework for the age-friendly public health systems movement that supports transformational change in the way health departments and public health organizations think about and address the health of older adults. So we are also generously funded and partner with the Johnny Hartford Foundation. And with the foundation, TIFA is helping public health practitioners understand how they can prioritize older adult health and well-being as part of their core work through policy and systems and programmatic changes. We do this through capacity building and training and recognizing and celebrating state, local, territorial, and tribal health departments all across the country as they achieve this transformation. And we do this through this framework, thinking about how public health practitioners can create and lead change, can connect and convene sectors, can help coordinate existing supports, can collect data, enhance communications, and certainly complement the programs and services that are already being provided in a community. We feel that the public health sector is uniquely positioned to also create and lead multi-sector efforts to build better data systems, enhance community planning, and better coordinate previously siloed efforts focused on supporting older adults and caregivers. We're also currently leading efforts to coordinate sector engagement to develop strategies, tools, and resources to support stronger and more consistent and active collaboration across all the sectors of the age-friendly ecosystem. So I'm going to be really excited. I am excited that I'll be able to share with you in just a few minutes some examples of what this looks like. Back over to you, Jody.
Great, thank you. Next slide. The third sector of the age-friendly ecosystem is maybe familiar to many of you, the AARP's network of age-friendly states and communities. And this movement was started initially by the World Health Organization way back in 2006, and it's had a significant transformative effect on cities, towns, communities all over the world. It arrived here in the United States in 2012 and was led and continues to be led by the AARP, and now known as the Network of Age-Friendly States and Communities. The effort really focuses on making communities more livable for people of all ages, especially older adults. And it is key to a framework of 8 core domains of livability that you can see represented on the wheel on the screen. And the framework really is focused on the activities, actions, and focus areas that enable older adults to age in place and engage in community life. As of 2024, the network includes, this number is a little bit of a moving target because it's continuing to grow, but 913 communities, collectively serving more than 116 million people. Including over 38 million individuals age 50 and older. Membership in this network is really centered around a 5-year process, and that includes an assessment component where community needs are evaluated, and then the subsequent development of a corresponding action plan to enhance livability across these 8 domains. And then after the action plan is developed, an implementation phase is begun where the community would be working together towards the goals outlined in its action plan. And nursing homes can and should have a seat at the table when it comes to the development of these plans, given their role as home base for so many individuals in the communities where they operate. The action plans often start with municipal leadership, not always. Sometimes it comes outside of municipal government, but it can also begin with municipal leadership, and those leaders engage stakeholders from across the community. So this is an exciting area of opportunity for nursing home leaders and residents to think about sort of their doorway into the ecosystem through this community work. And we'll give you a little bit of information in a few slides about that. Next slide, please. Sort of narrowing down from a big community-wide effort, another sector that's working within the age-friendly ecosystem is what is called the Age-Friendly University Global Network. The network describes itself as a movement that aims to shape how we live and work by increasing educational opportunities across the lifespan, which is very much sort of individually focused. It's also just known as an association of higher education institutions who are committed to promoting positive and healthy aging and enhancing the lives of older people across the global community through innovative educational programs, research agendas, curriculum development, online education, health and wellness activities, arts, culture, civic engagement opportunities for individuals living and in these communities where universities that are participating exist. The program is now based at Arizona State University, and it remains committed to thinking about how higher education can contribute to making a global age-friendly world. So we'll give you some examples of how you might engage with universities as well if you're considering this as your doorway in. Next slide, please. And then age-friendly workplaces and businesses. You know, so much happening in healthcare, so much happening in communities. We've talked about universities, but it's happening beyond those sectors as well, including workplaces and businesses. The Age-Friendly Workplace Initiative has gained a lot of momentum in recent years as organizations, employers, understand and respond to changing demographics and increasingly recognize the value of creating inclusive and welcoming environments for workers of all ages. We know that today older adults make up a large and growing segment of the workforce. In response, the AARP launched its Employer Pledge Program in 2012 to provide employers a way to affirm and celebrate the value of experienced workers and age diversity, and to promote the value of older workers to its employee base. The program, the Employer Pledge Program, allows employers to commit to equal opportunity for all workers regardless of age, and to recognize the importance of experienced employees in their workforce. But it's not just the workforce side of the equation where we see this work emerging. There's a growing movement for business owners to recognize the power of those changing demographics as well. I'm based here in the Boston area, and Brookline, Massachusetts, a community right outside of Boston, actually created a specific age-friendly business campaign, and that works to encourage businesses to go out of their way to be hospitable to older people. The campaign recognizes businesses for the age-friendly features that they offer. And it enlists businesses in an effort to become more age and dementia friendly. This is a win and an opportunity for nursing homes to consider finding ways to engage in and support these kinds of developments. Next slide, please. So we've looked at these various sectors, you know, giving you just the tiniest top line introduction to them. So where we think about this as leaders of the emerging age-friendly ecosystem is to say, okay, we understand what these sectors are, or we're beginning to understand what these sectors are. How could nursing homes get connected in? Well, one place to start is with a process called partner mapping, and we've just tried to visualize that very broadly here on this slide. It's a well-known tool for evaluating partner sets, your current partner set, and also for zooming out just a little bit and asking who could be at the table who isn't already here? Who are the partners that I'm working with as a nursing home resident, as a nursing home administrator, as somebody who's engaged in this work? who are we not talking to? Who do we know? What relationships do we have access to? What do we bring to the partnership? And what are we looking for in our partners? This is a process that we go through with providers and practitioners and stakeholders from across the age-friendly ecosystem at a very high level when we think about systems change, but also we encourage our partners and the people that we engage with in our work to do this at the very local level. Like, how do you develop those partnerships? Well, first it's figuring out where do you already have partnerships and where could you or might you have partnerships once you understand what's out there. So it's sort of a two-pronged effort, getting smart about what's out there and then figuring out how to back into it. So I think of partner mapping as a really valuable and important step on the road to considering how nursing homes can get more connected to the larger age-friendly ecosystem. So Megan's going to give us a few examples in the next few slides to sort of wet your whistle, so to speak, on looking at different partnerships that exist and hopefully jumpstarting some of your own thinking. So I'll hand it back to you, Megan.
Absolutely. Thanks, Jody. Next slide, please. So yeah, we want to go from the theoretical to the real world, to some real world examples that will hopefully jumpstart your thinking and in terms of how your nursing home or your community can kind of be intentional about engaging with different sectors in the age-friendly ecosystem. So the first example here is how a local public health department in Florida supports nursing home residents in the face of and following disasters, and why it's important for nursing homes to know your local health department, your public health practitioners. Some local health departments are quite large, some are quite small, but it's important for you, we feel like, to engage in them. So this is in Charlotte County, Florida, which is in the lower kind of central part of the state. Part of the hurricane response protocol is ensuring that all nursing home residents are accounted for after like kind of planning for, but then certainly after a disaster like a hurricane. And once that happens, then they start identifying needs, such as whether someone needs mental health counseling or whether they need a replacement of durable medical equipment. So very concrete needs of nursing home residents. And if a resident needs to find a new place to live, it's often the public health department that will lead that effort. And that actually did happen in another county in Florida following the round of most recent hurricanes there. Public health agencies are also working in many jurisdictions across the country to ensure that nursing home residents are supported in the case of extreme heat or extreme cold events. And this is particularly the extreme heat events is kind of a new phenomenon based on some of the climate changes that we're seeing, but it is something that public health is attending to. And so it's really important, as I said, to kind of find out who your local health department practitioners are, who's leading it, who else can come in and help. And then public health also is responsible for infection control. So, of course, during COVID, we had public health practitioners across the country visiting with and making sure that that nursing homes had PPE and had kind of all the infection control protocols in place. So they're crucial. They're not accountable, of course, for the kind of health administration aspects of the work, but they will come in and help with some of the very practical aspects of what nursing homes need to attend to. So next slide. And so Jody talked about universities and academia and some really cool educational opportunities that age-friendly universities and really all universities can provide. So residents can take classes, learn about and practice. And I think that's an important aspect, is to actually practice using technology and can stay engaged in the community and engage with other like-minded community members. And by the way, this isn't a one-way street. Nursing homes can provide career development opportunities for students to come in and learn about how a nursing home should operate and is operating, and opportunities to work with older people and administrators to see those things in action, to build those skills and think about the workforce that we need for the future. So it really is kind of a two-way street. In Middle Tennessee State University, they have something called the Positive Aging Consortium. And this is what kind of jump-started their thinking about their age-friendly work and what led them to apply for and become the first university in the state of Tennessee to become the first age-friendly university in the state of Tennessee. But the Positive Aging Consortium provides opportunities to bring older people into the university setting, and they provide all kinds of programming and arts opportunities, and they bring different aspects of the university into this consortium. So it's a really cool model, and we hope that will be spreading, but a lot of opportunities to engage with academia. Okay, Jody, I think I turn back over to you now.
Yep, thank you. As I mentioned, age-friendly communities are happening all over the country and in fact the world, and they happen at the statewide level, they happen at the city level, they happen at the town level. It's really dependent on community involvement. The District of Columbia has had a really robust age-friendly movement for quite a few years. They call it Age-Friendly DC, and they currently have 26 organizations and community-based entities involved in implementing its plan. So they've gone through multiple versions of the assessment of an evaluation as to what's important for residents of DC. And they've pulled together this very diverse group of engaged partners to implement their plan. So as we think back to the framework and the 8 domains of livability that encompass the age-friendly community's work, each of these localities can decide which one of those sort of pillars they want to lean into. And so I see a great opportunity for nursing homes to be part of the community planning if it's new for the community where residents and administrators operate, or jumping right in, because there's usually ways to tie into the plan that's been in development. So in DC, for example, they currently have a 5-year plan that includes program initiatives focused on improving parks and recreation areas, implementing a safe at home project for home modifications for older residents, a ride sharing effort, intergenerational gardening, and providing education on financial exploitation schemes. And so it seems clear that there's ways for nursing homes to participate in those programs, but also to add value to them. And it's, as Megan said, really a two-way street. So to me, from my perspective, it's a really easy and accessible way for interested parties to get involved with the age-friendly movement by figuring out who's leading the age-friendly initiative in your community, and then finding out what their priorities are and deciding how and where it makes sense to engage in that work. Next slide, please. We also wanted to share an example of this work happening in rural America, because we know that so many of the older adults that we're serving live in places where access to services and programming and even transportation is certainly not as easy as it is in city and suburban environments. This is a little bit of information about a program in Nebraska that we learned about at a gathering of national leaders from across all of these different sectors that was held last April in Washington, D.C. And it refers to a community-wide implementation in Nebraska that they call age-friendly health communities. This work started with age-friendly health systems as its sort of base, and then really tried to develop and broaden out its influence and impact on older adults across the state. The goal of this initiative, the Age-Friendly Health Community Initiative, was to bring age-friendly, the movement, into other aspects of elderly patients' lives and to provide more comprehensive care using evidence-based practice throughout the care continuum, the 4 M's that Amanda had referenced for us earlier today. And to develop community partnerships, coordination of referrals, resource access, and a whole communication structure to sort of wrap around all of the elderly care and resources. In the work, what we're really trying to do is to pull together a variety of partners, hospitals, nursing homes, clinics, agencies on aging, senior centers, the Department of Health, vision clinics, pharmacies, dental clinics, palliative care, technological vendors, and to bring those partners together to create a larger, broader, multi-sectoral approach to addressing the needs, desires, and challenges of serving this community. So it's a really interesting example that we can provide in the follow-up for those folks listening in today from rural areas around how you can take this ecosystem-centered approach to the work and pull together disparate partners to the benefit of older adults. Megan, back to you.
Yeah. So yeah, this is our last slide, and then we're happy to engage in some discussion with you all. But we wanted to leave you with just a couple of questions. So why should your nursing home be part of the ecosystem? Why would you want to do this? What are you hoping to accomplish? What are the first steps? So we hope we've given you some ideas to spark your thinking and some strategies to think about how to engage within the ecosystem. And I guess that when we approach our age-friendly public health system work with a small health department, we often ask them, what are the unique needs of your community? So I would ask you, what are the unique needs of your nursing home and your nursing home community? And what sector do you think can help to address those needs? So that could be like, the first place that you might want to think about it. Of course, age-friendly health system, because is a really good first place to start, because that is going to immediately have an immediate impact on your residents and how we think about them and how we care for them. So I think we can take the slides down at this point, Isaac, and engage in conversation.
Yeah, boy, that was a lot, and I know you guys, and I know that was a lot, but it was great. I think we can. Yeah, we've got everybody back. So we've got Amanda back and all of you. I want to follow up on a couple of things that have been questions in the chat, but specifically, just to put a fine point on what you guys were just talking about. Can you just say maybe one more sentence or so about nursing homes being leaders of age-friendly within that community ecosystem? And Amanda may want to jump into, but just, you've got a lot of people on this call who are living in a nursing home. They're a relative or, friend of somebody in a nursing home. We'll talk in a minute about the ombudsman, but anything else you want to add to what you already said, just about that nursing home focus potentially?
Yeah, so I mean, you all know your community, your people, and your needs. And so I would start there and thinking about how can you raise awareness of the needs of your community, your nursing home, with leaders who are engaged in the ecosystem, and maybe it's simply a call to your local health department and say, I'm so-and-so, I'm a resident. I'd love to engage with you and find out, how we can begin to work together to support the needs of my community. So that's one way to just step up and become a champion.
Right. And I'll just add to what you said that, again, a lot of us who've worked in nursing homes for a lot of our career, it's not always true that everyone in the community knows what happens in nursing homes. They don't know who we are, what we do, who works there, who lives there, right? And so the opportunity here is nursing homes often provide incredibly wonderful age-friendly care, and they implement it, and it's part of how they do things. So they can be seen as the experts, and they can be out there promoting themselves as experts if they are, in fact, experts in age-friendly care. So I just thought that was important to put a point on that. And also Renee Delmonico wrote in, what is the best way to identify which area community partners are already working on this to collaborate with? So Jody, do you want to take that?
That's such a great question. And one of the things we're working on is helping to surface that information, because I think there is so much work happening and it's really, really hard to know how to find it. So for example, you can go to the AARP's website and try to figure out where communities near you are engaged in this work, or you can call your local Department of Health and ask if they're engaging in this work. You can call your local hospital, or you can find out, is my local hospital an age-friendly hospital or health system. And Amanda pointed out that those resources are also available on the IHI website, and start there. We can go to the universities, the Age-Friendly University Global University Network, and find universities near us and figure out who is at the university leading that work, because they're going to probably know. But this is the challenge. We've got all of these operators happening and working in these silos. And what we're trying to do with this ecosystem movement is to pull it together in a way that's accessible for people like all of you on this call, so that you can find that information without having to, bang your head against the wall looking for it harder than you should have to.
Right. Great response. Thank you. I want to turn to the long-term care ombudsman programs, because we've had this fantastic conversation going on in the chat where people are saying, oh, I'm on too. I'm on from this day. I'm on from Pennsylvania, whatever. So I don't know who might want to chime in first, but it seems that the chat is really asking for connections with other long-term care ombudsman programs. And I'm just going to offer anybody who wants to come off of mute and say anything about the program they're involved with, or, I know there's some national work through NASOP and other organizations that bring together across states the different programs. And of course, we have local, state, and national programs with an ombudsman. But if anybody would like to chime in, and Kim, I see your hand up, but I wanted to, before we end, I wanted to be able to get to that. So please feel free to come off mute and say something about your long-term care ombudsman program connections.
And please raise your virtual hand if you want to unmute, so that I can find you and recognize you.
No, but nobody has anything more to say. Linda? Yeah.
Good morning. Ombudsmen are usually pretty forthcoming, so I'll break the ice. I'm with the Long-Term Care Ombudsman Program in San Luis Obispo, California, and yes, ombudsmen are in a excellent position to introduce the idea of age-friendly care to the nursing home community. How that contributes or fits into the other work that ombudsmen do remains to be seen. Most of us have our hands pretty full already, but I'd love to see some activity at the NASOP level, maybe through consumer voice as well, to advocate these ideas.
Thank you. And the National Consumer Voice you just mentioned is one of the advocacy organizations that's involved with us. We spoke yesterday with Justice in Aging. We have a number. I see Wynn Gerhardt and Senator Moore and other people from my home state of Massachusetts on this call. And I know a lot of you are doing national advocacy that's so important. So Kim McCrae, go ahead and share your thoughts.
Hi, everybody. This isn't about long-term care ombudsman, but I am very curious. There's a lot going on with the dementia-friendly movement and the departments of public health that have BOLD grants. And have you all seen any way that dementia-friendly and age-friendly has been kind of crosswalked? Because there's a lot of dementia-friendly that isn't wearing the age-friendly hat. I think if we could do more to crosswalk those two, it could be awesome, because anything we do to make things dementia-friendly helps age-friendly. So I just wanted to put it out there. Have y'all seen any work on that? I haven't been able to find any good information about that yet.
Yeah, there's a lot happening actually at the state level. Our friends at the Mississippi State Department of Health are doing a lot of work. I know Dr. Keena White, who leads that work there, was registered. I don't know if there's so many people. I don't know if she's on the call or not, but that's also happening in Georgia. In Georgia, they're doing a lot of work to bring those two efforts together. So it's happening, and we can find
I know that I'm in Georgia, so
okay.
I just wondering if nationally y'all have seen that happening more.
Yeah.
Yeah. go ahead. Go ahead.
I was just going to say, Joe Angelelli's on this call. He's also one of our Moving Forward Coalition members and leaders. I don't know, Joe, if you want to add anything to, because you answered Kim's question pretty directly. There you are.
Oh, I'm unmuted now. Oh yeah, yes, just it's one of our work groups in our age friendly. So we've kind of aligned the dementia friendly community work. It's very, very nicely synergistic.
Great, great. Diana's had her hands up for a while, so I'm going to call on her next, but I also wanted to say Michelle Snyder's just put in the chat a question about CMS age-friendly hospital measures, and IHI, Amanda, myself, and others, we work very closely with CMS on those attestation measures. They're just for hospitals right now. There's a lot of interest in that. So we can have a much longer and Amanda chimed in too. So we can have a longer conversation, but yes, we're working actively on that. So I'm going to go to Diana next, and then we're going to be close to wrap up. So Diana, go ahead.
All right, thank you. Very quickly. I think it's an attempt. I'm actually in one of the GWEPs. So for there's a Pacific University, also Mayor and I at UCLA. I'd be very interested in Linda Beck's email to sort of connect and see who's doing LTC ombudsman kind of in some of this area and find out what's happening there. So if you would put that in the chat, Linda, I would absolutely love that. The other thing is I'm involved nationally leading. They're actually now doing for the GWEPs in the next probably targeting June to put up modules for age-friendly care, all the 4 M's, and 3 or 4 GWEPs are involved in each of the sections. So we're doing one on what matters in terms of interprofessional learning and work, and then caregivers, et cetera. So there's some of that is beginning to come together, which I think I've been involved in nursing home work and age-friendly work for a while, but the nursing home work and assisted living I've been doing for 20 plus years with dementia and behaviors and things like that. But I'm very excited at least to have all these people so invested and moving forward. So that's terrific. Thank you very much.
Well, thank you. And I'm going to turn it over to our Senior Program Officer, Jane Carmody, to give some concluding remarks here for us. But this is a fantastic call today. I mean, there were 115 people at the height of the call, and you all had great comments in the chat, and it was a great conversation. We could have stayed on for another hour, but of course we won't be able to. Before I turn it to Jane, I just want to thank our speakers. As you could tell, these people have incredible expertise. They're actively working every single day all across the country. And we're just so grateful that you joined us to hear about all this. And we hope you will all join. You can still join the Moving Forward Coalition. You can click the Get Connected button right on our website. And, again, we're glad to have everybody who might be interested. And I know Tifa and Jody would say the same thing about their public health work. So just really grateful for them. Jane.
Oh, well, what do you say after a conversation, a webinar like this? It's just been amazing to developing it in the first place. And then what I would say is, I think, Alice, Isaac, the Moving Forward Coalition has brought nursing home into the conversation here. Sometimes we talk about age-friendly ecosystem, but you're really bringing nursing homes and why not and should be front and center. So thank you so much for this wonderful webinar. And thank you to Megan and to Jody and Amanda and Alice and Isaac and the whole team. And thanks for attending. I said to Alice privately, I don't hardly know too many people on this. Usually it's people we know. So it's just so wonderful to have such a large group of interested people, all of us together to improve care for nursing homes. So thank you, Alice.
Fantastic. And Jane, to your point, Jen Raymond just said she's interested in the teaching nursing home program. So, and she put her email in there. So, and Jen and I know each other. We go way back. So glad you were with us today. Anyway, thank you all. Isaac came back on camera after doing all the tech management. Isaac, you can close us out, sir.
Just a little housekeeping. The recording will go up on YouTube in the next few days. We'll include a bunch of resources in the description of that. So if you want to share this or find any of that stuff, you'll find it all there. And then the other thing is that our next coalition conversation is going to be really looking at QAPI, quality assurance and performance improvement practices in nursing homes from a really ground up perspective. I think a lot of people hear QAPI, it sounds like a duck. And if to you QAPI sounds like a duck and you want to know what it actually is, this would be a webinar for you. So thank you so much for being here. Thanks to our speakers. Thanks to Jane. Thanks to Alice. And we'll see you all next time.
See you next time. Thanks so much.